And welcome to Wellness Live. My name is Dr. Olivia Moses, and I am your host for this half hour. Thank you so much for joining us. Well, we have a special guest here today and a very important topic to talk to you about. Now, do you know anyone who has suffered from asthma? Well, the likelihood that you do is pretty high, especially here where we're based out of in Southern California. There are a lot of things that we have in our air that potentially could exacerbate asthma. And so we have a very special guest. His name is Dr. Laren Tan. He's one of our wonderful physicians here at Loma University, and I have so enjoyed working with him and look forward to this presentation as well. He is an associate professor of medicine, and he is also the director of LLUH's comprehensive program for obstructive airway diseases. And he's here to talk to us about asthma. So without further ado, I'd like to introduce you to Dr. Laren Tan.
Thank you, Dr. Moses. Wanted to thank everybody for taking the time. I want to begin with this wonderful comment that a friend of mine had told me that, it's difficult to already work, especially if you work at Loma Linda. It's hard work. We don't doubt that. But then to come in every day and see your face on the computer screen makes it that much harder. And I just can't help but laugh at that. And there is just a comment to tag into that. And that is, our breathing does not actually need to be hard, especially with asthma and COPD. And I thought that'd be great for us to be able to transition into the presentation. I'm going to share my screen here. And as stated previously, from what Dr. Moses had already stated, we're going to be talking about asthma, but I also want to segue a little bit more into COPD too. These two diseases are actually intertwined in a lot of very different, in similarities. They have similarities, but there also are some little small differences, and we'll go through that with our presentation moving forward. So key points that we're going to be, at least what I'm going to be addressing moving forward is symptoms of asthma. What are the triggers for asthma? How is asthma diagnosed? And then initially also, what are these treatments that can actually help us to breathe better, especially if you have asthma? And then lastly, how do we prevent worsening of symptoms if you actually have asthma too? It is important to note that, at least from what you've heard from many of pretty much friends of perhaps you yourself have asthma, and that is these symptoms, right? The cough, the wheezing, the chest tightness or pressure, and also breathlessness when we're actually exerting ourselves. And the cough can be extremely problematic. It could be a wet cough or it could be a dry cough. But really the key and what is causing all of this is that there's a lot of inflammation going on within the airways, meaning the airways are irritated and it makes it very hard to breathe. And what's hard to be able to control about asthma is that there are many causes for this. The two most common, we could say, causes, at least for asthma, we could say there's an allergic component and there's a non-allergic component. And of course, there are a lot of various different triggers that go along with it. And so when we talk about triggers, we talk about when the airways are exposed to something very specific, it irritates it, it causes more swelling, more mucus production, the airways become narrow. In a lot of ways, actually, the airways become hypersensitive. Any little thing can cause it to squeeze or get tightened. And what are some of these things that can actually cause that? Well, pollen is the most common thing, right? Especially during springtime. Strong smells, chemicals, extreme weather changes as we're getting into winter, coming from a warm, and our weather has been a little bit finicky, right? One day it could be hot and the next day it could be cold. Along with that, smoke, dust mites, stress. Can you imagine laughter for some people can actually cause you to go into asthma exacerbation? Viral infections, this is so key, especially in the era of COVID, right? And then lastly, there's always exercise-induced asthma. So knowing these triggers can be very important, but also trying to understand how are we actually diagnosing asthma too. There is no single definitive test at this time that we're able to do and then say, you definitely have asthma. Asthma is a clinical diagnosis, meaning that it takes multiple components. Let it be your history. So that could be, again, your allergy history, your family history, and also perhaps other diseases that you might have, eczema or allergic rhinitis. These type of diseases share the same inflammatory pathway that across the board. And so it's good to be able to know that. In addition to also, do you have pets at home? And is your breathing worse when you actually get home? And as a result, do you actually have the symptoms that I previously mentioned? And there are also tests such as breathing tests, which is very key. Imaging can be helpful. There is such a thing as exhaled breath biomarker testing that we actually have available at Loma Linda 2, skin testing, and then also blood biomarker testings. All of these things put together help us to be able to formulate if you actually really do have asthma or we're actually dealing with something else. So to recap a little bit on what we've actually gone through, I've talked about the symptoms, right? Whether that be a cough, we say it's productive or non-productive, wheezing, chest tightness, pressure, breathlessness, the various different triggers. And then again, remember that for asthma, the diagnosis is a clinical diagnosis. So we look at the history, we look at your symptoms, in addition to also the various different tests. What we'll move into next is actually looking at treatments and preventions. And so with treatments for asthma, it's very key to be able to remember earlier I said it was chronic inflammation. And it's the chronic inflammation due to these triggers that you continue to inhale. So what we're trying to do is calm down the inflammation and also open up the airways. And why is that? Because the airways are narrow due to swelling. There's more mucus production because of the inflammation. And remember, earlier I talked about how they're hypersensitive and all this tightness and squeezing. So we're trying to be able to treat all of these things simultaneously. So this way we can improve your breathing, especially if you have asthma. So things that we can do. One, first and foremost, try your best to avoid the triggers. I have some patients that are extremely allergic to a lot of various different things, and it'd be hard for them to live in a bubble. So we still want you to live an active life. We want you to live a well life, right? And so there are medications such as quick relief inhalers that help to quickly open up the airways. A lot of this, maybe you've heard, is like an albuterol inhaler. Other controller inhalers help to actually control the airway inflammation and also help to open up the airway so you can actually breathe better. Most recently, based upon recommendations and also guidelines, we've actually found out that there is actually a way to use some of the controller inhalers as a quick relief inhaler. And it goes beyond the scope of this talk to dive too deeply into that, but it is important to know that sometimes some of the controller inhalers we're using can also be used as a rescue inhaler. But we're going to have to wait until the FDA approved, but these are different guideline changes that have actually occurred. And then what's very exciting in the era of asthma, we have a lot of various different biologics or injections now, newer injections that can actually help control your asthma. And then lastly, we want to be able to prevent, of course, any infections that could occur that could lead to an asthma exacerbation. So we always want to be able to promote vaccinations, again, from flu and also now with COVID. So how do we actually prevent worsening of asthma? It's very important to know your triggers, because if you can actually identify your triggers, you can minimize your contact with those triggers and then minimize the airway inflammation that I actually talked about previously. Know and take your asthma medications as prescribed. Also, it's very important to be able to recognize the early symptoms that you actually are experiencing that could lead to worsening of symptoms. And so we want to stop things very early. And that's the key to be able to have at least an asthma action plan to work with your physician on that or your provider with that. And lastly, this is a slide that summarizes really everything that we've actually talked about, from symptoms to triggers to the diagnosis to the various different treatments. And then more importantly, what we always want to do, especially here at Loma Linda, is prevent worsening of illness or prevent illness in general. And so I hope that this is a great kind of high-level overview. And if there are any questions, I'd be glad to be able to answer it now, especially with Dr. Moses.
Thank you so much, Dr. Tan. This has been hugely interesting, and we have some questions coming in. And I want to remind our audience that if you have questions for Dr. Tan and you're watching us live, go ahead and type them in the comment section. We'll be able to ask him straight from the expert's mouth. So, Dr. Tan, we actually have some questions regarding pollution and your lungs. And I think this segues also into a question about, you said, we need to keep these irritants, at bay and, try to minimize them. How do we know what is an irritant for us? And with the pollution, is pollution an irritant, and how would we know?
That's a great question. Dr. Moses, it is so hard, especially here in the Inland Empire, to be able to be, we could say, smog free, just based on our location. And we, throughout the years, this time and time again, to actually show that the higher the particulate matter or pretty much particulate count is within our air, the more likely that someone with a chronic respiratory illness is going to have symptoms. And that even includes asthma in addition to even COPD. Earlier, when I was saying that, triggers something going into the air, I mean, the best thing that we need within our lungs is just clean air. That's the reason why we try to stop from smoking. We try not to be around smokers. And pollution is one of those things too. And it's hard. It's even harder with the wildfires that go on. So if at best, we always try to be able to create a safe zone, meaning that if there are wildfires, or let's say smog is extremely heavy outside, stay inside. When you're driving, put your windows up. Have a room where perhaps, sometimes having air filters or room air filters inside the room can be helpful. So this way you're not continually inhaling these triggers that worsen the airway inflammation.
We have another question that came in that said, should I eat a special diet because of my asthma?
That's another great question, because we also realize that food allergies can also affect our overall inflammation. So things that cause a lot of inflammation do not help out the airways either. So we want to be able to avoid foods that and other, I would say food or even drinks that you may be actually allergic to that can cause you to have more mucus production, more worsening breathlessness, and can cause wheezing. So yes, definitely any triggers, whether that be inhaling or even orally eating, you would want to avoid.
Want to avoid. So it's a good question, and I love the proactiveness of this question is, what can I do to improve my lung health?
There are two things. Well, maybe a lot more things than that, but we always encourage, at least I encourage all of our asthmatics to always exercise. The whole point of being able, when we're exercising, we're using muscles we wouldn't ordinarily use if we were just sitting around or just not doing too much. But I understand it's a catch-22, because if you can't breathe, it's hard to exercise. But I know that there is a way for us to be able to get you to breathe better to the best of our abilities. I get it. Nothing's 100%. But exercising, eating healthy, breathing in clean air, those are all key things to be able to make sure that you have strong and healthy lungs. We have to be smart, right? On what we eat. We have to be smart when we exercise. We don't want to go exercising when there's wildfires all around us. It doesn't make sense. So it takes a little bit of planning, but it's definitely doable.
Great. Well, we have time for a couple more questions here. Is it healthy to exercise outdoors? And you kind of mentioned that. So, is it time of day? And how do we know? How do we get the information that the pollutants are high?
Yeah, there are a lot of different apps. Now that we've got smartphones, you can check the particulate count outside. You can check smog levels outside. You can check the pollen count outside. I think that is one step. If you realize that during springtime, that is the worst time for your allergies and that's the worst time for your asthma, that may not be the best time to be able to be exercising outside. I've got a lot of patients where cold air really triggers their asthma. So maybe it'd be better to actually exercise when it's warmer in the day. When it comes to pollution, when it comes to smog, after about midday, closer towards the end of the day, that's when smog levels are actually much higher too. And so that may not be the most opportune time for you to exercise. I get it. With our work schedule, it's hard because we try to fit things in here and there. And I think that's where it's important to make sure that you have your rescue inhalers that I talked about, and you're also constantly on your maintenance inhalers if you're already on it. Those two things will help you to be able to get through your exercise, although we still want to be mindful on when we exercise.
Perfect. Thank you so much for answering these questions. And one last one before we get to the second half of your presentation. We talk about asthma, and then we also talk about this condition called COPD. How are they related? Are they in the same conversation? What's the difference between them?
Oh, Dr. Moses, that's such a great question, because if we had to look, Okay, and if I had to look at between asthma and COPD, they both fall under the umbrella. And I'll define what COPD is moving forward in my presentation, but it's chronic obstructive pulmonary disease. They are both obstructive airway diseases. To kind of jump on we could say another organ system, or perhaps something that a lot of us have heard about or more familiarized with, is you can consider it as airway constipation. It is harder for air to actually come out. And it's okay to laugh, Dr. Moses. I saw that giggle right there, because asthma makes it hard for air to go out, and so does COPD. It's just that the disease process is a little bit different. And that's what I'll go into a little bit more moving on in my presentation.
Okay, perfect. Well, let's get to the second half.
Excellent. So just very much like what I've previously stated with asthma, we're going to go through very similarly the same key points. We're going to go through the symptoms of COPD, or chronic obstructive pulmonary disease. I'm going to define it a little bit more for everybody. We'll go through what the causes of COPD, how COPD is actually diagnosed. And this is where it's a little bit different from asthma too. The treatments for COPD are very similar, but perhaps where certain treatments are added, that's also going to be a little bit different. And then how to prevent worsening of COPD symptoms. So what is COPD? Well, if you had to define it and break it down, COPD, chronic, meaning a long-lasting disease, obstructive, makes it hard to move air in and out, right? To that constipation part that I just talked about. Pulmonary disease that affects your lungs, obviously, and the disease is an illness and damage. So all of these things really kind of what define COPD. And what is it actually really damaging? It could affect two things. One, it could actually affect the air sacs, or we call the alveoli, where because of what we would say more commonly due to smoke or some damage, there's destruction of these air sacs and they become bigger. And that's when you've probably heard the term emphysema. That's when these little alveoli sacs get joined together and become very big. You may think bigger is better, but in this case, actually, it loses its function to be able to do the gas exchange that the lung commonly does. The tubes also of the airways can actually be irritated and damaged too. And so that's when we start to hear also the comment of bronchitis or chronic bronchitis, a lot of mucus production. And that's because of the smoke damage, most commonly, which causes COPD. The common symptoms with COPD, you'll notice it's very similar to asthma, right? It could be a cough with or without phlegm. There could be wheezing, there could be chest tightness or pressure, and breathlessness. And some may actually think in your mind, well, then how do you actually differentiate the two? Well, the key component is going to be the history taking and also a couple of tests, which I'll discuss moving forward. So the majority of causes of COPD, right? The majority of the cases is actually due to smoking, pollutants, gas, or particulate inhalation, right? The number one cause for COPD in the United States and even globally is still tobacco smoking, and that's with cigarettes. And you can also still get secondhand smoking, but you're talking about something that is you've been exposed to your entire life. There needs to be a good amount of smoke inhalation, especially when it comes to secondhand smoke. Not to say that you can't with just a little bit. So if you can at all just avoid it, that's probably the best thing. In addition to that, chemicals and dust can also contribute to the development of COPD. The minority of cases, we realize that sometimes there's deficiencies in various different enzymes, such as alpha-1 antitrypsin, that can actually cause that. Genetics can actually cause and play a role in that, where there's faster degradation of these elastin or these fibers to help keep the airways open. So these are the different causes. But again, to emphasize, the majority of the cases tend to be more smoking related. And so that's the reason why you'll see I'm going to harp on this more and time again. And that is, don't smoke. And if you are smoking, stop smoking. Now, the diagnosis of COPD is slightly a little bit different from asthma. While it is still important to take a good history, it is important to be able to better understand the symptoms. A big key component for us that at this time that we look at is really requiring a breathing test or a spirometry test. And based upon this spirometry test and this ratio that we look at on the amount of air you're able to exhale out, then we can actually tell definitively whether or not you have chronic obstructive pulmonary disease, COPD. As you can imagine, it's harder to breathe air out, and so we can actually measure that with this spirometry test. Just based upon the history of smoking and also on imaging, it could clue us into actually saying, you know what, I think you have COPD. But again, you do need the spirometry test in order to come up with that diagnosis of COPD. So much like what we did previously with asthma, here's a recap of COPD. We've talked about the symptoms and how it mirrors very closely with asthma. But the causes, what you'll notice is that it's different, right? You're inhaling a lot of smoke, pollutants, gas, and particulates, and there are also host factors that could be factored into that. And then the diagnosis, which is different from asthma, right, is that it requires spirometry. It requires actually a breathing test to be able to definitively have COPD. But we will not exclude also wanting to make sure that we have a good history and understanding your symptoms, and then perhaps other tests that we can actually look at. We will also, again, move forward on the various different types of treatments for COPD, and also how can we actually prevent COPD, right? Especially the exacerbations. So much like asthma earlier, remember, these are both obstructive airway diseases, right? There is constipation, there's airway constipation, air can't come out. And so how do we actually open up the airways? Well, then we would bronchodilate. That's when we use these bronchodilators. Earlier, I talked about short-acting bronchodilators and then their controller inhalers. It's very similar. We want to be able to open up the airways. And in certain instances, especially with COPD, where there's a lot of mucus production and we find that there's a lot of inflammation, in those cases, an inhaled steroid then is actually appropriate. But where it differs in COPD and asthma treatment is that with COPD patients, if we don't need inhaled steroid, we're not going to want to add that on. In asthma, we realize that it is chronic inflammation. So the first thing we're going to go to is an inhaled steroid. So while both diseases may seem similar, their treatments may be a little bit different. And that's where it gets a little bit complex, but it is good to know at least that they do have similarities and we can differentiate the differences too. So the type of treatments for COPD, smoking cessation. I mean, that's top of the list. We don't want you to continue to inhale voluntarily at least a strong concentration of pollutants that could cause damage. We've got carcinogens, we got a lot of various different things that could end up hurting the lungs. And so if you're smoking, definitely stop. If you're not smoking, don't smoke. Again, I'm going to emphasize what we emphasized previously with asthma, and that is the only thing that should be going into your lungs is clean air. Okay. Quick relief inhalers, again, will quickly help to open up that obstruction. So this way air can actually go out, and so you can take a nice deep breath in. Controller inhalers, we actually have longer acting medications that help to open up the airways. So this way you can better breathe in and out. And what's interesting also for COPD is that there are other medications that we can try to use to save the use from oral corticosteroids. Some of these are mucolytics, some of these are antibiotics, some of these are also to help decrease the inflammation like PDE4 inhibitors. But in cases where it's so severe that we can't control it, much like asthma and COPD, steroids are going to end up being used. What's also another nice component about COPD and something that we offer here at Loma Linda is pulmonary rehabilitation. It is a great program and it goes further than just you would commonly think about rehab. In this case, it is supervised exercise, and many of our patients are on oxygen and they're being supervised as they exercise. There's a lot of education, there's a lot of self-management, and all of this improves breathlessness, anxiety, depression, and also increases exercise tolerance. It also helps to form a community of other COPD patients, and you turn to look and you go, hey, if he can do it or she can do it, well, I can do it too. It's very nice in that sense. And then lastly, there are some patients with COPD that do require oxygen. Is that the end of life? No, it's not. I think we have got a lot of COPD patients that live a very active life, from golfing to actually hiking with their oxygen. And then I'm going to plug in again, we want to be able to increase your immunity to be able to fight off any infections that could come your way that could make your COPD worse also. And so vaccinations are also very key. And that includes the flu vaccine and, again, our COVID vaccine that's now available. So how do we prevent worsening of COPD symptoms? It's very similar to asthma again. Smoking cessation is key, right? Use your COPD medicines as prescribed. It's going to be personalized with your provider. Track your COPD symptoms. There are very key signs and symptoms that can help our COPD patients to realize that, hey, my breathing's actually getting worse. I'm getting more mucus production. I'm getting more cough. I may actually have an infection. What is my COPD action plan? And what are the medications that I can actually use to help prevent worsening COPD symptoms? And these are all key things that can be personalized with your provider, especially here at Loma Linda. And Dr. Moses, this is again the last slide of my presentation where we've gone through, at least with COPD, the symptoms, the causes, the diagnosis, the treatments, all right, smoking cessation, and then the prevention key. And that is it.
Well, thank you, Dr. Tan. This is a hot topic. We're getting all kinds of questions, so I'm just going to go straight to the questions. We have one coming in here, and you talked a little bit about it, but if we could address it again, that would be great. How do we offset or protect against the increasing pollution in our areas as a result of, here in Loma Linda, they're probably around our area, of all the warehouses and distribution centers that continue to pop up?
There is definitely a lot. That's a great question. There's definitely a lot of data that is supporting that around train yards, that around a lot of various different locations where air pollution and what is being exhaust from combustible engines actually worsen the symptoms, at least for those that actually live around that area. That's a very difficult question to also answer in the sense that the wind could blow any way. And also we've got various different wildfires that could add on to that whole equation. If you have the means, if we all had the means, the financial means, we would pick up and move. But sometimes that's not possible. So, I would say what can be done, at least at best, is to try to stay away from those areas if at all possible. Jobs are also very important for our area, especially here in the Inland Empire. And I would say that the bigger emphasis that we've looked at is that decrease in education, at least level of education, leads to increase use of tobacco use. And we know that the number one cause of COPD is tobacco use. So if we can somehow elevate our living situation and also providing more jobs, I think that in the long run will also help out for us to be able to provide those around the area with proper health care, better education. Hopefully that will lead to less smoking, and then that will help out in the overall scheme things of COPD. It's a fine balance, and I don't have a great answer for that, but I think it's very important that we look at the whole picture, not just, oh, there are more warehouses, therefore there's going to be more COPD patients or more exacerbations.
So a quick question, a follow-up question to that is, to make your home, how can we make our home kind of a healthier lung place to be? Now, what are your thoughts on these? If you have central air, these the filters and these air purifiers that you can just really buy on Amazon now, what are your thoughts on those kinds of things?
I think all those components can help. There's not a whole lot of strong data that's going to support and say that it's going to decrease exacerbation. It's going to make it so where you're not going to go to the hospital less, that type of deal. But it definitely is going to help, especially when you have got great air filtration. So this way you're actually breathing less particulates going into you, especially when you're sleeping. In the asthma scenario, what we always want to be able to say is that if your pets are coming in and sleeping in your bed at night, that may not be the best thing. A lot of times, I don't know about you, but I know my mouth is open and I'm just sucking in everything that's all around me. And although, many times people say, I'm not allergic to my pet, that's great. But what are your pets actually picking up on their fur when they're out and about? And that could be bringing into your bed, and that can be an irritation. When it comes to air filtration, what we found is just a HEPA filter is just perfectly fine. There's no need for all these different oxidizers and whatnot. We actually could be more harmful for you if you're in an enclosed space. So, simple is better. Just get something that filters out the air if that is something that you feel is going to help you to breathe better, especially in a safe room.
Wonderful. We have more questions coming in. It says, I have recently been diagnosed with COPD and I still smoke. Is it too late to quit smoking now that my lungs are already damaged?
It is never too late to quit smoking. And I will say that again, it is never too late to quit smoking. Um, what we have found, at least looking at data, we can actually see that the decline of lung function, the more obstruction, you're going to have more constipation, we'll put it that way, of airway constipation, occurs the longer and the more you smoke. Stopping now will help your lungs to be able to kind of go back to the way or the normal lost lung function that a non-smoker will actually have. So that's why it's never too late. And we always want to encourage our current smokers to stop smoking. It doesn't help out to continue to keep damaging your lungs because it's already damaged. It's something, but that being said, also, we also completely understand that nicotine addiction is an extremely hard thing to quit. And so it's going to take work, it's going to take time, and it's probably going to take a team effort to get you to stop smoking.
We have actually a follow-up. So we talked about nicotine a lot. This one says, I only smoke cannabis. Am I still at risk for COPD? In addition, I've also heard I smoke cigars, so we don't really inhale, so that should be fine. So what are these other things that people smoke? What's your opinion about those?
Those are great questions. To my knowledge at this time, and we haven't been able to prove, the strongest association with COPD is by smoking cigarettes and tobacco smoke. Although cigars, we commonly say it's going in the mouth, it's coming out, you can't help but inhale what you've just exhaled out. So I am sure there's still going to be particulates and smoke inhalation going in. As it pertains to marijuana, we have not been able to prove that it leads to COPD yet. And the key is yet, right? I think as we start to gain more data, much like early on when cigarettes was very common across the nation, we couldn't prove it at that time that it was causing COPD, but it's only a matter of time before we'll have more data to be able to see where and what does it actually cause. What we do know is that with marijuana, it paralyzes the little cilia, the hair that helps to move up the mucus from our lungs to their central airways to build a better cough up phlegm. So when you paralyze that cilia, guess what? You're going to actually get more mucus pooling. You're going to get more junk that's stuck in your lungs, things that shouldn't actually be there. And as a result, a lot of patients with prolonged marijuana use of smoking have a lot of chronic cough issues, have a lot of mucus production. And it's just because of the nature of what you're actually smoking. Now, if what we're smoking marijuana for are for medicinal purposes, there are alternative ways to be able to get that without smoking. And that's what we encourage all of our patients to do.
Great. So one last question. You kind of mentioned an asthma action plan, and there may be some of our viewers out there that have asthma, don't have a plan. We might have some, asthma patients out there also that are using the ER or their urgent care because they don't have an exacerbation that often, so then they're using that as their action plan. What would your advice to be, and what is an asthma action plan?
The advice for those that constantly are having exacerbations or their asthma is not well controlled, there's definitely a reason. And I've gone through that, looking at identifying your triggers, making sure you're on the right medications, making sure you're taking the right medications. But all of this actually circles around having a good, I would say, starting off with a good primary provider. Not all asthmatics and COPD patients need to see a pulmonologist like myself. Our primary care physicians here at Loma are very well versed. They understand the nuances of being able to treat our patients with asthma and COPD. So I'd say that is like the first step, Dr. Moses, to be able to at least connect with a good primary care provider and then work off the treatment plan for there. And this asthma action plan is really, you're looking at, okay, what are your rescue medications, your short acting medications you're actually using? What are your maintenance inhaler medications you're actually using? And if you're starting to use more of this short acting or quick acting inhaler, something is acting up. You've got worsening of your respiratory symptoms. And that's kind of what's leading to an exacerbation. And so if you're leading to that, these are the emergency medications that you have, that is when you start using. Or this is when you start contacting our clinic office and we will give you further recommendations. All of these preparations, I could say it's kind of like your safety and fire plan that you would have at your house, right? You want to get everything planned out. You want to get everything ready that in the event something does happen, you're good to go. And that is something our providers here at Loma that can help you to plan out, or wherever your providers are at near you.
Thank you so much, Dr. Tan, for your time today. Unfortunately, I'm looking at the time. That's all we have time for today. But thank you so much for being with us. And thank you, our viewer, for being with us as well. We hope you join us next month on December 18th when we talk about a look back of COVID-19 for 2021. You won't want to miss that presentation. Also, if you know of someone who could use this presentation that Dr. Tan just spoke about, go ahead and send them the link. Well, again, thank you again for joining us. My name is Dr. Olivia Moses, and we'll